Greetings and thank you and welcome to another edition of To Your Health here on GBMC Facebook Live. I want to thank our audience for being here today and all of you at home or at work watching us on Facebook. Today we're going to talk about winter health and safety. And with that temperature out there being so, 25 degrees and that wind howling at 35 miles an hour, Mother Nature is kind of laughing at us, but we're kind of hoping we're going to be able to turn it around on Mother Nature and kind of laugh at her with our preparation and being prepared and dealing with winter weather. Joining us today is Dr. Jeffrey Sternlicht. He is the chairman of the Department of Emergency Medicine at GBMC. Dr. Sternlicht, I want to thank you for joining us today and for coming out. Appreciate that. So let's talk about winter health, right? I mean, it's cold outside, it's the wind is blowing. So one of the first things is how do we protect ourselves from the frigid temperatures? I mean, I know it's not that cold right now, but the frigid temperatures and when that high wind and the wind chill kicks in.
Well, first thing you need to do is just be prepared. So it's all about preparation as far as dressing right, having your vehicle prepared, having your home prepared. And preparation is key to everything because if you plan for things, you will be able to protect yourselves.
So you mentioned about preparation is key. I think that's really the message that we want to relay here. But you talked about clothing. So what is the best clothing for cold weather?
So the important thing with clothing is a couple things. The fabric and the material is very important. So you want to stick with synthetics and wool. Those will dry quickly. Those wool will insulate when it's wet. You want to avoid cotton. So that's number one. Stick with the right materials because if you're cold and wet, you'll succumb to hypothermia a lot more quickly. Number two is dress in layers. So you want multiple layers, loose-fitting clothing, and so forth, and that will help insulate you better and protect you. And then number three is just make sure you wear hat, gloves, and that type of thing to make sure you're not going to lose heat from those areas of your body. So
before we started the program today, you and I have spoken times about frostbite and hypothermia. Let's just start off with frostbite. What is frostbite and what are some of the immediate symptoms that you see or when frostbite is taking place and how quickly can it progress?
So frostbite essentially is freezing of the tissues. So when the tissues go below freezing temperatures, they start to die. And that can happen actually at temperatures as high as 35 degrees. You can still succumb to frostbite. So as far as how fast this happens, this can happen very quickly in really cold weather. So, today is a cold day. It will happen much more quickly today than it would be if it were 32 degrees. But if the temperature goes below zero, it can happen in minutes. And basically, the symptoms are severe pain to your extremities. They can get white or red, become numb. Those are some of the things you need to look out for.
So let me ask this question. Who's at most risk for developing frostbite and why?
So there are several risk factors for frostbite. Number one is anybody who's going to be exposed a lot. So the people that probably get this most commonly are actually winter sports people who do a lot of hiking and snowboarding and things like that, people who work outside. But also there's physiologic risk factors. So somebody who's got a heart condition or vascular disease. Multiple medications can also increase your risk for frostbite because it's circulation and has to do with the way you maintain or lose heat in your body.
Okay. I want to encourage everybody at home who's watching us on Facebook and the audience, of course, if you have any questions, please feel free to submit them in the comment section of our Facebook page, and also you can private message us if you would like. Let's just go back to frostbite before we get to another question is, what are some of the prevention tips? Like what can you do to avoid it?
Well, again, this all comes with preparation. So know your weather conditions before you go out. Know what the forecast is. So that's number one. Number two is, proper clothing, proper shoes. Your hands and your feet and your face are probably the greatest risk for frostbite. So just make sure you have gloves or mittens. And in a real cold weather, I actually have both. I have gloves that I wear under mittens to really increase the insulation. And then just remember that when you get wet, wet increases conduction. Therefore, you really want to stay dry, because once you become wet, you'll get frostbite or hypothermia much more quickly.
It's funny you mentioned wet, because we got a question from Lisa saying, why shouldn't I go outside with a wet head? I think what she meant to say is wet hair, but can you answer that question?
So there's pretty much three mechanisms of heat loss in the winter for people. It's conduction, it's convection, and it's radiation. So what happens when your body is wet, or when your hair is wet, you're going to have more convection of heat, and the heat transfer from your body is going to be accelerated into the cold environment. So water increases convection and even conduction. That's how you lose heat if you fall into an icy lake or something like that. So if you're dry, you're going to have less of that heat loss. So yeah, it increases your risk factors.
In one of your answers earlier, you mentioned hypothermia. Let's touch base or talk about this a little bit. What is hypothermia, and how does it happen? And what does it actually do to your body, or how did your body react to hypothermia?
So hypothermia is when your core temperature drops below 95 degrees Fahrenheit or 35 degrees Celsius. And there's several different stages of hypothermia. So that's the most mild stage, and then when your body drops below 90 degrees, I think that's the number, it's severe hypothermia. So there's different stages, but essentially what hypothermia does is your organs do not perform optimally, and you can go into multi-organ failure eventually with hypothermia. And it affects your heart, it affects your respiratory system, it affects your neurologic system, it affects essentially every organ in your body. So it's very serious, and I've seen people die over the years with hypothermia.
So like I asked you with frostbite, who's really at risk for hypothermia?
It's pretty much the same population. It's going to be people that are out there exposed to it. I'll tell you, alcohol and drugs give you huge risk factors, and a lot of the patients we see with hypothermia are those who are intoxicated, those who are homeless and don't have a way to warm themselves. The elderly are more likely to become hypothermic. And chronic disease also increases your risk of hypothermia.
Joining us today is Dr. Jeffrey Sternlicht, Chairman of the Department of Emergency Medicine at Greater Baltimore Medical Center. I encourage you, all those at home watching us or at work watching us on Facebook, and our live audience, please submit your questions. Dr. Sternlicht he's got a plethora of information that he told me earlier he really wants to get out to you guys today. So please feel free to submit your questions. We do have one question that came in. It says, for seniors, how should they limit or pace their efforts in snow removal tasks? They ask this because so many seniors suffer serious problems while doing this.
Okay, I'll answer that in two parts. Part one is there's a lot of people out there that would recommend avoiding it at all costs for seniors or anybody with, and when I say seniors, actually a lot of the recommendations out there say if you're over 40, you shouldn't be shoveling. So that puts me in that category. So the heart attacks that we see, generally it's 40 and over, but again, there's deconditioning and chronic disease that will increase your risk factors. So somebody that's active and healthy, you can probably raise that up a little bit. But the recommendations out there are anybody over 40 should really avoid this. However, I realize not everybody's going to listen to that. So if you are going to do it and you have no other options but to shovel, a couple things. I think the things you need to look out for, generally it's three things. Probably one thing that people don't look out for is slipping and falling. That's number one, so you got to be really careful because a fall could really put you out. Number two is, obviously the risk of heart attacks and so forth. So for that, the recommendations are go slowly, okay? Use a small shovel. It's recommended that you push the snow rather than you lift the snow. Take small bites of the snow. Don't take a lot of snow on the shovel, and take frequent rests. So take a lot of breaks, go inside, warm up, and don't overexert yourself because that we do see a lot of heart attacks because not only is the exertion of shoveling a risk factor, but the cold weather is also a risk factor. The colder it gets, the more vasoconstriction that your body gets and the more clotting that your body can have. So we do see a lot of this, so something you need to be really careful about. And again, I would recommend avoid it if you can.
Okay. We have a question from our audience, and here's the question. They say, it seems like your nasal passages become more dry in the winter. You got any helpful hints?
I don't have great hints for that. Yes, basically what happens is the humidity drops in the winter. So a couple things. You can humidify your house, and at least indoors that will help you. You can apply Vaseline outside your nose if you want, and that will sometimes help moisten the air. But again, when it gets really cold and really crisp, there's really not much you can do to avoid that, at least outside. But humidifying indoors will help.
I was just informed that we have another question from our audience.
We do.
Anybody?
We have Howard. He has a question here.
Some portion of the senior population exercises regularly. And if you go into the gym on average several times a week and you do cardio work for an hour and a half, are there any special things that we should be thinking about in terms of preparing before we go into the gym and then after we come out of the gym in terms of taking care that we don't change our exposure to the temperature between the way we worked out for an hour and a half and then we go outside, particularly in the colder weather?
That's an awesome question. So I would say the most important thing, again, for any workout, it's warming up properly and cooling down properly. So what I would not recommend is run up the stairs in the gym and start a heavy workout immediately, and then when you finish, run out and go out into cold weather. That's the wrong way to do it. So when you get there, again, slowly warm up. That not only will help your cardiovascular system, but that will help your joints as well. So that's really important. A good 10 or 15 minutes of warming up prior to your workout. And then when you finish your workout, I would recommend a nice cool down period, meaning, gentle walking, gentle stretching, things like that, where you slowly let your body sort of cool down, and I think that will help make you more safe. But I will say I commend you for staying fit because that is a good way to prevent a lot of the risks from hypothermia and exertion and those type of things as well. So a fit body and a healthy diet will really help prepare you.
Nice question, Howard. Thank you so much. Joining us today again, Dr. Jeffrey Sternlicht, Chairman of the Department of Emergency Medicine, talking about winter health and safety. Okay, we talked about frostbite, hypothermia, exposure to outside, but one of the things that we see a lot of is viruses and illnesses during the winter. So let's talk about that for a minute. Look, we all know there's no vaccine to protect you from catching a cold, okay? There isn't none. What are some of the ways to lessen your chances of coming down with an illness during the winter months?
So it's pretty much the same principles of health during the winter are the same principles of health all year round. So what you can do to prevent yourself from infectious diseases is enhance your immunity the best you can, which is same principles of enhancing your cardiovascular system and enhancing the respiratory system, etc. So basic principles that I think everybody's heard before. Number one, healthy diet. So eat plenty of fruits and vegetables, whole foods, avoid processed foods, avoid junk foods. The more whole foods, fruits and vegetables, better your diet, the better your immune system is going to be, the less risk of illness. Number two, proper sleep. We all know, all of us, myself included, we don't get enough sleep. The less you sleep, the more likely you are to get sick in many ways, whether it's, again, cardiovascular or infectious. So if you can maximize your sleep, work for at least 7 hours, preferably 7.5 to 8 hours, that will decrease your chances of getting sick. Number three, exercise. Again, you should move every day. You should do something every day, at least 30 minutes, preferably an hour. Movement that keeps your circulation going, keeps your body healthy. We're designed to move, so I would do that. And then finally, the thing we talk about more in the winter, but again should be a year-round strategy, is try to avoid your risk of catching things. So hand wash and hand hygiene is huge. So make sure you're washing your hands. Make sure you're not touching your mouth, your nose, your eyes when you're out and about. That's how we catch things. If you're sick, stay in to prevent yourself from transmitting illnesses to others. And if you're not sick, do your best to avoid others, particularly people who are sick. So I think you stick with those principles, that maximizes your chance of staying healthy.
Great information. Thanks, Dr. Sternlicht. Do we have another question from our audience? No? Okay, it's all right. We got questions. We did have a question that came in from Taylor, and they wanted to know, we've been told that we are most prone to being infected with certain viruses, including the flu, and we're going to touch on the flu next. Between the months of November and January, what are some of the other most common viruses or sicknesses during the winter months?
So we do tend to see more infectious illnesses during the winter. So we're going to talk about influenza a little bit more. Obviously, the common cold, we see that a little bit more this time of year, the rhinovirus. Children are at risk for RSV, which is a respiratory virus, which could be pretty, most kids do fine with it, but it can be very serious for a certain subset of very young children and premature infants and so forth. And then there are the gastrointestinal illnesses. Norovirus is a year-round virus which causes vomiting and so forth. We see that a little bit more in the winter. So again, there are a lot of viruses out there. Again, sticking with the principles I talked about earlier will help prevent it to the best of your ability, as well as obviously vaccinations, flu shot being one of them.
Real quick, because believe it or not, we're almost running out of time here. Let's touch up on influenza. What is the influenza? Give us a short answer, one that we can all understand. And also, why is getting your flu shot so important?
So influenza is a very common virus that we see this time of year. We're starting to see it, and we'll probably see a lot more of it in the next couple of weeks. It's transmissible person to person, usually by droplets, coughing, sneezing, touching droplets, and so forth. The number one strategy for reducing flu is vaccination. So everybody should be vaccinated. I've been vaccinated every year since 1992, and I will never miss a vaccination. It's incredibly important. And it can make you very sick. Again, the extremes of age, very young, very old, chronic illnesses, and so forth. And I think the most important thing that people don't know is you can transmit the flu virus for up to 24 hours prior to being symptomatic. So that's a key thing here. Somebody could infect you with the flu, or you can infect somebody else with the flu without knowing it. So that's why this is such a tough virus.
Okay. Earlier we talked today, you mentioned about being safe, not just at home, but also in your car. And you and I have talked about having certain items in your car in case you get stranded, right? So what are some of those items you should have extra in your vehicle in case you get stranded during a winter storm or during the winter weather season?
So yeah, this is something I'm very passionate about. It's all about preparation. And the first thing is know your conditions before you go out and avoid going out if you can. But if you are going out, communication is number one. If you get stuck and you don't have a way to get out, that's a problem. But if you have communication mechanisms such as a cell phone and in a cell phone charger, your car can charge your cell phone, but if your car is dead, you can't. So have a charger that's ready to go. If you could have a second cell phone, that would even be better. I didn't go that far. So that's number one. Number two is if you can't get out, you want to really be prepared. The causes of death in survival situations are, you can go 3 weeks without food, 3 days without water, 3 hours of exposure. So exposure is the most important thing. So make sure you have items. I have a fleece, I have extra gloves, extra hat, I have warm socks, I have a second pair of socks, I should say, and I even keep a blanket and a sleeping bag in my car just in case, because if you get stuck somewhere and you can't get out, that will help keep you warm.
Just a couple of questions before we end our segment for today. There was another question that came in. Removing the snow and ice following a snowstorm is vital. We talked about being dressed properly, but what can you do to prevent injuries while shoveling or walking on sidewalks or stairs?
Okay, I view this as probably the most important question of the session, and I say that because of all the things we talked about, the number one thing that I see in the emergency department year after year is falls on ice, slips on falls, and they can be deadly. You break a hip, that could be very serious, or you can hit your head. Anybody on blood thinners, that can be really serious, but anybody in general. So that is probably the number one risk factor. So expect ice. This time of year, just expect you're going to go out and there's going to be ice and you're going to slip and fall, because people don't expect it. That's the number one problem.
Right.
So then from there, salt, sand, roadways, and so forth. If you don't have help and you actually have to get out there, I'm going to say, very easy to slip. But if you have to walk, make sure you have good traction shoes, slow, short steps, deliberate steps, a railing if you have access to it. Keep your hands out of your pockets and so forth, and things like that, because slipping on ice is the most common thing we see, and it can be incredibly dangerous. So be prepared for that.
All right, we had a bunch of questions submitted, and let's get to them with some quick answers. Are there any creams or protectants that protect face and hands against hypothermia, similar to how sunscreen protects from sunburn?
Again, first of all, I would recommend sunscreen even this time of year, because the sun still can be dangerous and still causes. So sunscreen is good any time of year. So that. As far as creams and so forth, a layer of petroleum jelly can help. Nothing completely protects you. When it gets really cold, I actually have a hat that protects my face as well when it gets close to zero and so forth. But Vaseline petroleum jelly is probably one of the only things I can think of, but it doesn't make you immune by any means.
Okay. I'm hearing that this year's flu vaccine is not very effective for this year's strain. Should I still get vaccinated? Okay.
Definitely, you should. I've heard the same thing, but it still will prevent certain flus, and it does mitigate the symptoms of flu. So even if you get the flu, you may get a less serious flu. So you should get it every year, no matter what the reports say.
How do I decide which cold and flu medicine is most effective?
Well, you hear different things from different people. I personally believe that the risks outweigh the benefits of cold and flu medicines. Generally, what I recommend if you're sick, Tylenol is the safest. Tylenol will help you with the fever, the aches, the pains, and then just fluids and rest. That is my cocktail. I don't believe in most of the other over-the-counter medications. They have a lot of side effects and so forth. So I don't recommend them.
We have a question from our audience. Yes? No? No question from the audience. Well, listen, Dr. Sternlicht, I want to thank you for joining us today and giving us all this great information. And I want to thank our audience and those that watched us on Facebook for tuning in and being here today. But most importantly, I hope you all learned something new and that you'll feel more confident during the winter weather months coming up, and that you're ready to take on Mother Nature, although I don't want to take on Mother Nature. That's not my cup of tea. I just also want to thank Mindy, who helps put this thing together, To Your Health. Mindy, you've been a lot of help, and I just want to thank you very much. Before we close, and I know you're familiar with this because you've walked around our medical campus, this year GBMC is trying to lend a helping hand to the House of Ruth. We're trying to help the House of Ruth in its mission to providing shelter and necessities to victims of domestic violence and sexual abuse. So if you visit the website, www.gbmc.org/House of Ruth, it will take you to the website where you can order items in need for the House of Ruth from our Amazon wish list. So please, if you can give generously. It's a great organization. They do a lot of great work. So we really appreciate your help. Join us next month here on To Your Health as we talk about cervical cancer and cervical health. January, in case you don't know, is Cervical Cancer and Health Month. So please join us here on Wednesday, January 10th, same time at 12:30, when we are joined by Dr. Kimberly Levinson, who is a gynecologic oncologist. I told you, Mindy, I'd get it right. Didn't I tell you? I told you I'd get it right. Well, that's really it for me. Again, thank you for joining us, and cheers. Cheers. To your health. It's okay. It's a festive occasion.